Some hope. The first human trial of a vaccine that could protect is underway in Washington state. Moderna Therapeutics, a biotech company, is working with the NIH to administer the study. It's testing a vaccine in 45 people and ready to make millions if successful. It could take months before a vaccine reaches the public. Seth Berkley is the CEO of Gavi, set up by the Gates Foundation to help vaccinate millions of children in the developing country. Seth, I hesitate to do these vaccination stories because, I want it yesterday. I want you to tell me that it's available, and I want you to tell me that you've got plenty to give me, and that's not going to happen in any time soon.
That is correct. I cannot tell you we have plenty to give you or any to give you. But what I can say is we have an unprecedented effort that's going on. At last count, there were 44 vaccine approaches in the WHO list that are moving forward, and some people, there's double that number. So science is leaning in on this. Of course, it will take some time.
Okay, so the thing I do want to focus on as well is COVID-19 is only now starting to hit the emerging markets, Africa, parts of Latin America, those who are least able, whose health services are basically on their knees to begin with. How scared are you?
That's exactly right, Richard. A few weeks ago, we hadn't seen a lot of cases in the developing world. Of course, there wasn't a lot of testing, but we didn't see bodies building up, in the main teaching hospitals. So we were surprised, but of course, it would have been a fool's errand to say it's not going to get there. Since then, in our 73 poorest countries, 60 of them already have cases, and the death rates and the numbers of cases are going up. And you're absolutely right. Those countries are less well prepared for it. The health systems are not as strong. And of course, a lot of the people work in the informal sector. They can't just rely on social, nets that are going to help them during this time. So it is tough. The one silver lining, perhaps, is that the population there is much younger, and therefore they may not get quite as much of a burden of very severe disease. But as you know, it can be severe in younger people as well.
Besides the testing side, which I understand takes time, why is it so difficult to come up with a virus? I mean, I realize that's a big question for a simplistic answer. But, I mean, to those of us who don't know anything about the vaccine business.
So the way the vaccine business used to work is you would know if you got measles, natural measles, and you didn't die, you didn't have any complications, you were immune for the rest of your life. Same thing with yellow fever, same thing even with smallpox. So if you could get the same immune response that those diseases gave you without getting that severe disease, you'd be protected. Of course, we don't yet know how long you're protected, if the immune response is strong enough, is it lifetime? So one has to understand a little bit of that immunity and then target the type of approaches. Of course, you have to test it not just in healthy people. You got to test it in the elderly, in young people. You have to make sure that it's safe. And then you have to figure out how to produce it. And in this case, it's not millions of doses. It may be billions of doses. So all of that takes time. But of course, the world will do everything they can to try to accelerate it.
The idea of herd immunity, I mean, eventually herd immunity is exactly what you do get if you haven't got a vaccine. But and you'll be familiar in the UK, everyone was talking, even though the government denied that was the policy. Is herd immunity a valid thing to talk about, or is it a bit of dangerous nonsense?
Well, first of all, it depends upon the disease. Some diseases, like measles, you need to have 95% of the population have been either vaccinated or infected before you have herd immunity. Other diseases like Haemophilus influenza type B, a common cause of pneumonias, probably 60 or 70%. Right. So it depends. But again, we don't know in this case whether we get long-term immunity. The common cold coronaviruses, you can get reinfected with them after a time. So the concept of herd immunity, first of all, means in this case, you'd have to have, 50, 60, 70, 80% of the population infected. A lot of deaths would occur with that. And then it might be that you don't get long-term protection. So I think this is something we'll learn about. Hopefully we can get herd immunity with a vaccine, but it's not something that I would be going for with natural infection as a first choice.